This is Radio Health Journal. I'm Reed Pence. This week, to shake or not to shake?
The chances are more likely than not that the hands that you may choose to shake are probably not going to be clean.
Hand washing and handshakes when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Everything from school lunch programs to technology to where they're going to locate schools, all of that is based on people answering their census and us knowing that you're out there.
Don't forget to fill out your census form this spring. Then,
what addiction involves, actually, is a disease of those systems that control your decision-making. So it's a disease of decision-making.
Why is it that some people can reach sobriety and others can't? I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
Most doctors see anywhere from 20 to 30 patients a day and commonly shake hands with most of them. However, studies show that fewer than half of doctors have been compliant with good hand hygiene protocols before they've gotten to you. So are you sure you want to shake hands with your doctor when you go in for a visit? Or how about when you're lying in a hospital bed and can't wash hands yourself?
I think people have recognized for many years now that hands represent important vectors for disease, and that for healthcare professionals, in particular doctors and nurses who are taking care of patients, particularly vulnerable patients, we need to wash our hands and make sure that we're not spreading disease. People are coming to see their doctors to get better, not to get sick.
That's Dr. Mark Skolansky, professor and chief of the Division of Pediatric Cardiology at UCLA Mattel Children's Hospital and the UCLA David Geffen School of Medicine.
So it's important for doctors and nurses to wash their hands, but it's not just a matter of sprinkling on a little bit of alcohol-based gel back and forth for a second or two, or even wetting your hands in the sink for a couple seconds and then drying your hands. It has to be done in a way that actually has been demonstrated to be effective, to actually clean your hands and get rid of the viruses and bacteria that can cause infection.
But studies show that healthcare workers are sometimes too rushed to wash hands, or especially at the end of a tiring day, they simply forget. Sometimes sinks aren't nearby, and washing hands dozens of times a day can produce a lot of skin irritation. So, only 40% of healthcare professionals are actually compliant with good hand hygiene protocols.
The actual rate of effective compliance is probably much less than 40%. So the next time you as a patient or your family member as a patient goes to see a doctor or a nurse at a hospital, the chances are more likely than not that the hands that you may choose to shake are probably not going to be clean.
Skolansky doesn't believe the problem is going to change anytime soon. So to protect his patients in the meantime, he's established a handshake-free zone in the neonatal intensive care unit at Mattel Children's Hospital.
This campaign, which I believe in my heart is the right thing to do, to minimize the use of handshakes in the healthcare setting, particularly if you're working with vulnerable patient populations. It's not to mean that I don't believe in the importance of hand hygiene. Of course, hand washing is paramount and very important, and we need to keep doing everything we can to help improve compliance with hand hygiene. But it doesn't mean while we wait for much improved compliance that we shouldn't take other efforts that could also help save lives and improve the quality of care that we're providing. And I think one of those steps is to avoid shaking hands.
Skolansky says that a number of his colleagues nationwide agree that this policy is a good one to adopt at their own hospitals. But he says he's also gotten a lot of pushback within the healthcare community for both good and bad reasons.
Someone wrote an editorial in response to our initial JAMA editorial where they said you might as well suggest that you can't touch your patient. How do you examine your patient? It's a silly response because, of course, you need to examine your patients, but you have to wash your hands before and after you examine your patients. But when people shake hands, people don't generally expect they're going to wash their hands before and after shaking everyone's hands. So it's a little bit different.
The handshake is one of the most powerful ways to make a human connection with someone else. And as a registered nurse, I learned early on in my education and training that having skin-to-skin contact with someone, whether mother with child or even adult to adult, is the most powerful way to connect.
That's Donna Cardillo, a registered nurse and motivational speaker known as the Inspirational Nurse.
You can certainly transmit germs through handshaking, and one of the things we know in healthcare is a handshake is very important. We like to use it with our clients, our patients, but we're very, very attuned to keeping our hands clean and using frequent, proper hand washing and hand sanitizers when appropriate. There have been times when we've had flu outbreaks or flu epidemics in this country, and I remember one time the Congress and the Senate were putting a ban on handshaking to try to prevent the spread. But in healthcare, the power of the handshake is so significant that it's important for healthcare professionals to shake hands with their clients and patients. There's exceptions to everything, but at the same time, we're always practicing good hand washing and sanitation procedures.
However, good hand hygiene works both ways. While research shows that fewer than half of those within the medical profession are hand hygiene compliant, experts say the general public does an even poorer job.
What we do know, and research has proven this, that only 5% are washing their hands properly. So people are washing their hands, but they're not doing it correctly.
That's Dr. Pamela Marquis, a pharmacist in the Atlanta area.
The average person is going to come in contact with 300 surfaces every 30 minutes. That's a potential 840,000 germs. So just imagine your entire workday of about 16 hours. You're going to potentially touch almost 10,000 surfaces or 27 million germs a day. And as a mom of two myself and a pharmacist, hand washing really is a big concern, and it is a gut-wrenching reaction to see someone walk out of a restroom that hasn't washed their hands, or someone going to eat who hasn't washed their hands, because I'm very conscientious and knowledgeable about this process, and so it's a big deal.
So how do we do it correctly? Cardillo says a simple rinse under the faucet doesn't cut it.
One of those quick rinses is very ineffective. So you really have to cover your hands in water, clean water. You have to put some soap on that and create a lather on your hands and rub all around your hands, between your fingers, on your fingertips, under your nails, to the best of your ability. And in ideal circumstances, you should do that for at least 20 seconds. And when we teach hand washing, we say that you can sing the happy birthday tune twice. That takes about 20 seconds to do if you want to be that diligent about it. But that just gives you a sense of how long you need to do it. And then, of course, you want to rinse your hands under clean water and dry them with a disposable or a clean towel or under air. Everybody in the family using the same cloth towel isn't a good sanitary practice.
Every October, Global Hand Washing Day seeks to raise awareness about the importance of hand washing. But even here in the United States, not everyone has access to soap and water when they need it most. It can result in a public health crisis. And in San Diego a couple of years ago, it did. An outbreak of hepatitis A.
Predominantly affecting homeless or unsheltered individuals and or illicit drug users.
That's Dr. Wilma Wooten, Public Health Officer for the County of San Diego.
It has to be transmitted through fecal matter. That's the way. Fecal matter and then close person-to-person contact. So if an individual has fecal matter on them, it can be transferred to environmental surfaces. But the way to prevent us becoming infected is washing our hands and to perform proper disinfection practices so that people don't spread that small fecal content or matter, get it on their food, and then eat it. The only way we can infect ourselves is by consuming the fecal matter. So it could be all around us, but as we don't consume it, then we cannot be infected.
That graphically highlights the importance of hand washing after using the bathroom. But according to the CDC, you should wash your hands after all kinds of activities.
It's important to wash your hands before and after you're preparing food of any type, and of course anywhere along the way as needed. And it's important to note that you should never prepare food for other people if you yourself are sick with a cold, flu, anything that might be transferable. It's important to wash your hands before and after you eat. Anytime that you're using a restroom or assisting others using the restroom, including diaper changing. It's important to wash your hands before and after putting contact lenses in your eyes because you don't want to transmit anything in your eyes or take anything out and transmit it. You want to use it any time before or after you're tending to any sores or wounds with a child, a loved one, certainly in healthcare, or even on yourself. So before and after caring for anyone who's sick in any way. Certainly after you are coughing, sneezing, or blowing your nose, you should be washing your hands. It's great to immediately wash your hands as soon as you come back from any public places, the food store, the train, kids from school. Good to get them in the habit of washing their hands as soon as they come into the house, and adults should do the same thing.
Cardillo says we're also supposed to wash our hands after petting our cat or dog. So come to think of it, maybe a handshake-free zone isn't such a bad idea.
So many people think if you shake someone's hand, you're showing kindness or compassion, but that's not always the case. I'm sure you've shaken people's hands, and it hasn't been the friendliest handshake, and I've certainly done that too, been on the receiving end of a handshake that's far from friendly. So I think everyone has their own favorites, depending on the part of the world you're at, depending on your culture. I like the namaste. I like bowing gently. I like touching on the shoulder, and I certainly like eye contact and smiles.
But how about a fist bump? It's been proven to transmit far fewer bacteria than a handshake, but Skolansky isn't a big fan. Fist bumps also aren't a very warm gesture if you're trying to establish rapport with a patient. But how about outside the healthcare setting? Does Skolansky shake hands then?
Reluctantly, sometimes. No, I do shake hands, but listen, every time you shake hands, you need to look at the benefits and the risks, and most of the time, the benefits may be significant and the risk may be quite low if you're not immunocompromised, you're not in a healthcare setting, you're not in a setting where there's lots of pathogenic bacteria all concentrated. And so most of the time, this is sort of a no-brainer that it's probably just as well to shake hands, and the risks are quite small. But in other settings, for instance, in the NICU or in the cancer or oncology ward, then I think the risk-benefit is different. In those settings, I think it's a bad idea to be shaking hands, at least until we're at the point where compliance with hand hygiene is much better than where we're at today.
Studies show just about all of us can do a better job of washing our hands properly and more frequently. And there's a payoff for us. Maybe at the very least we'll get fewer colds or the flu this season. You can learn more about all of our guests and about proper hand washing hygiene by visiting our website at radiohealthjournal.org. Our writer-producer this week is Polly Hansen. I'm Reed Pence.
"2019 was a year of important discoveries about Alzheimer's disease and other dementias. Making news this year, researchers learned that Alzheimer's risk genes are different in men and women. This could help explain why 2/3 of people living with Alzheimer's are women. Other studies in 2019 found that vision and hearing loss may increase dementia risk, especially when both sensory impairments are present. There are also new discoveries about lifestyle, according to Dr. Keith Fargo, Director of Scientific Programs and Outreach at the Alzheimer's Association.
A healthy diet and regular exercise are good for your overall physical health, but researchers have also found that they can reduce your risk for cognitive decline and dementia. These healthy habits, along with things like cognitive stimulation, may even help people who are at high risk due to their genes.
Researchers say a simple blood test to detect Alzheimer's earlier is on the horizon. And 2 recent announcements have increased hope for new Alzheimer's drug treatments. To learn more about Alzheimer's research and how you can participate, visit alz.org.
Of the 358 million people who live with asthma worldwide, it is estimated that 10% have severe asthma. People with severe asthma struggle to control their symptoms, like chest tightness or difficulty breathing, despite treatment. Some severe asthma cases may be caused by increased levels of a white blood cell called an eosinophil, which can be determined by a simple blood test. Many may not realize their asthma is considered severe and continue to live with symptoms. Tanya Winders is the president and chief executive officer of the Allergy and Asthma Network.
So many of us take the simple act of breathing for granted. As an advocate and mother of children with asthma, I have seen how the condition disrupts everyday life. Many with severe asthma live in fear of being unable to breathe or their next attack, which can be terrifying and fatal. Each attack puts patients at greater risk of another. If you're not able to control your asthma, speak with a doctor to learn about treatment options.
For more information about severe asthma, visit allergyasthmanetwork.org. This spot has been sponsored by GSK.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free, and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this broadcast, please support our show by subscribing, sharing it with a friend, and leaving a review on Apple Podcasts. You can find more Radio Health Journal stories about health, science, and technology on Apple Podcasts, Google Play, Spotify, and RadioHealthJournal.net. Also, follow us on Instagram and Twitter at Radio Health Journal. Coming up next week on Radio Health Journal.
It's stacked against people who are overwhelmed by circumstance. When someone gets a bill, they freeze. They're overwhelmed. They don't know what to do with it. It becomes something they'll put aside.
Why nearly a quarter of Americans have medical bills they can never hope to pay.
Then how concussions can smolder for years without ever being diagnosed.
Mild traumatic brain injuries are a significant, major cause of mental illness, and nobody knows about it.
All that and more on Radio Health Journal.